Hi, I'm Michael. I'm a registered dietitian working in oncology, and today I want to talk about the bright blue liquid that keeps showing up all over your feed, methylene blue. Let me give you the honest headline right up front. Methylene blue is a real, useful hospital drug with a legitimate history, but drinking it at home as a mitochondria booster or a cancer cure is marketing, not medicine. Those are two completely different things, and the difference matters, especially if you or someone you love is going through cancer treatment right now. So what actually is this stuff? Methylene blue is a synthetic dye that is about 150 years old. It was one of the very first fully man-made drugs in history, and it has earned a genuine place in medicine. It is FDA approved for a condition called methemoglobinemia, which is a blood disorder where your red blood cells lose the ability to carry oxygen properly. In that emergency, methylene blue given by a medical team can genuinely save a life. It also gets used in surgery as a visual dye, and there is real, careful research happening in something called photodynamic therapy. In that research, methylene blue is applied to a specific spot and then activated with light in a tightly controlled clinical setting. That is genuinely interesting science. But notice what all of those uses have in common. Doctors, hospitals, precise doses, careful monitoring. None of them involve buying a dropper bottle online and squeezing it into your morning water. So why is everyone suddenly talking about it? A few reasons. Celebrities have been photographed with blue tongues and blue drinks, and that kind of image travels fast. Longevity influencers have picked it up and packaged it as a mitochondrial enhancer, something that supposedly supercharges the energy factories in your cells. And in the corners of the internet I worry about most, it has been folded into alternative cancer protocols, sold as part of a stack that promises to starve tumors or fix your metabolism. The videos are compelling. The blue tongue is a great visual. The word mitochondria sounds scientific, but a great visual is not evidence. Here is the honest state of the evidence, because you deserve it straight. There are no human clinical trials showing that drinking methylene blue treats cancer. There are no human clinical trials showing it prevents cancer. Full stop. The mitochondrial claims come almost entirely from lab studies, meaning cells in a dish and animal experiments, often at doses and in conditions that have nothing to do with a person sipping a supplement. Extrapolating from a petri dish to a person is one of the oldest tricks in the wellness playbook, and I see it constantly in my work. Interesting lab findings are the beginning of a research question. They are not a treatment. And the photodynamic therapy research I mentioned earlier requires the compound to be activated by light directly at a tumor site in a clinical setting. Swallowing the dye at home replicates none of that. Now let me put on my oncology hat, because this is where I stop being merely skeptical and start being genuinely concerned. Methylene blue is an MAOI, a monoamine oxidase inhibitor. That means it can interact dangerously with antidepressants like SSRIs and SNRIs, and the result can be serotonin syndrome, which is a medical emergency involving agitation, rapid heart rate, high fever, and in severe cases it can be fatal. Here is why that keeps me up at night. A large number of cancer patients take these exact medications for depression, for anxiety, and sometimes for hot flashes or nerve pain. So the very population being targeted with these cancer claims is the population at highest risk from this interaction. On top of that, methylene blue has dose-dependent toxicity. At low doses, it behaves one way, and at higher doses, it can actually cause the same oxygen-carrying problem it is used to treat. People with a G6PD deficiency, which is a common inherited enzyme condition, can develop serious red blood cell breakdown from it. It stains skin, urine, and tissue. And here is the part that genuinely shocks people. Much of what is sold online is not pharmaceutical grade. Some of it is chemical grade, or literally aquarium grade, meant for treating fish tank infections, with impurities and contaminants that were never intended to enter a human body. People are buying fish tank chemicals because a celebrity drank something blue. So where does that leave us? Let me be constructive, because I never want to just tear something down and walk away. If a physician uses methylene blue in a hospital for an approved purpose, that is evidence-based medicine, and I fully support it. If researchers keep studying photodynamic therapy in proper trials, wonderful. I will be the first to update this video if strong human data ever emerges. But self-dosing an industrial dye because an influencer called it a mitochondrial miracle is a different thing entirely, and calling it a cancer therapy when no human trial supports, that is worse than unproven. It is potentially harmful. If you are in cancer treatment and you are curious about methylene blue, or honestly about any supplement, here is my simple, practical ask. Bring the actual bottle, or a photo of the label, to your oncology pharmacist and have them check it against your complete medication list. That one conversation is free. It takes 10 minutes, and it can prevent a genuinely dangerous interaction. Your care team wants you to ask these questions. I promise no one will roll their eyes at you. So here is my bottom line. Methylene blue is a real drug with a real job in real hospitals. It is not a cancer cure. It is not a proven mitochondrial enhancer. And drinking it on your own is a risk without a demonstrated reward, especially if you take antidepressants. Save your money, protect your treatment, and talk to your team before anything blue goes in your glass. If this was helpful, share it with someone who has seen those videos, and I will see you in the next one.